Hi, I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician. So I'm going to tell you my experience of my patients in the last 25 years. People with obesity, the problems they face, and it's very sad how discriminated they are. As you know, in the last 2-3 decades, the discrimination of in other areas like racism, sexism, it's all coming down. But sadly, obesity discrimination is going up. So what I'm going to talk about is discrimination of people with obesity by healthcare professionals. That's my colleagues, doctors and nurses. So there's a study recently, not recently, just a few years ago, by Dr. Stuart Flynn from the Department of Psychology. He's a psychologist at Leeds, where I trained as an endocrinologist. So what they found out in this study was people with obesity are more discriminated than the general population, and they fare poorly on the international markers of quality care. That means they can't get quick access to healthcare. They do not get good communication from healthcare professionals. They do not get emergency care, and they feel that the preventive aspects of care which they should get, they do not get it. Eventually, they don't engage, so they don't return back to the healthcare professionals, so the care is poor, which is very sad. But again, there's another article about obesity stigma in the Journal of Nursing. It exactly said the same thing, that healthcare professionals have a negative attitude to someone coming with weight problem. So this particular video, the short video, is about the experiences of my patients and what I would tell my colleagues to do in future. So I'll give you 3 stories. One of my patients went to her general practitioner with a toenail infection. So when she went into the chamber, and she thought that the consultation would start, but the doctor completely pushed that aside and started talking about her weight and said, you need to lose weight. And she started to hear the similar stories. Whenever she went for a chest infection, a toenail infection, or a foreign body in the eye, the only thing she heard was lose weight. But never did she listen how she should do that. So what happened? She stopped going to the doctors. She started to seeing some people randomly online. So can you see over here? The healthcare has been compromised. Another episode or incidence was one of my patients went in, and because she was too big, her body mass index was around 65. And she took some time getting up from the reception, and she had problems with the knee, so she was using a Zimmer to slowly walk towards the surgery room. And when she went in, she had to squeeze past the door because the door was too narrow for her. And all this was taking time. And she could see her doctor getting restless. And he said, can you please make it quick? I got another meeting to go. And as soon as she sat down, he said, okay, what's your problem? And he didn't even lift his head up. Within a matter of minutes, she had a prescription in her hand. And she was quite stunned. And she started to walk out with tears in her eyes. And while she was walking out, the doctor said, by the way, can you try to lose weight? That will go a long way. And that's it. Can you see how rude that was? And the last of the example, I've got hundreds of examples of my patients suffering at the hands of my colleagues, but I'll give you another example. So this person was again very big, and what she did was she was waiting in the consultation reception, and she's waiting for the doctor to call her. When she went in, she couldn't find an appropriate chair, so the chair was too narrow and it had handles. Because it had handles, she couldn't sit in. She was standing, and the doctor started the consultation, and the doctor wanted to check the blood pressure to see if she has high blood pressure, but the equipment wouldn't work because he didn't have large cuff. So the next thing was the doctor tried to measure her weight, but the weighing scale didn't go above 150 kilograms. Clearly, the doctor couldn't help her because he didn't know what the blood pressure was. He couldn't make her sit comfortably and get a proper history. And then she was dismissed because he couldn't do anything. He said, just come back again When we had proper chat, she was crying. And the worst bit was he didn't even have a tissue box to give her to wipe her tears. So these are just 3 of the thousands of examples I've got of my patients. And it's very sad. And this is what I'm trying to see if we can stop this happening in the healthcare setting. But on the flip side, I won't blame the doctors. Because if you see worldwide in medical schools and colleges, obesity is not a topic. Probably it's just a few lectures, that's it. But why is it surprising? 1 billion people on this earth have got obesity. More people die of obesity than malnutrition. So every 8th person on this earth suffers from a weight problem. But there's no proper education. Why is there not proper education? Because the teachers of the would-be doctors, they're not properly educated. They don't know what the body language should be, what the words should be, and they use words like fat and big. The most appropriate word should be people with obesity, because it's a condition, it's a disease, just like diabetes or hypertension. So to start with, I wouldn't blame the doctors and nurses. I would blame the institutions, the government, where the education has to be upskilled among the teachers first, the professors. They should teach the students properly. So my advice to my colleagues is, first of all, you need to understand that obesity is a chronic disease. It's not just about eating less and exercising more. There are hundreds of reasons for obesity. It could be psychological, it could be hormonal, it could be genetic, it could be due to any medications, it could be due to environment. I can quote hundreds of reasons. But if there are hundreds of reasons, why do we tell our patients to eat less and exercise more? Because you would look stupid if you said the same thing which every patient knows. So another thing to remember is every one of your patients knows that they're going to eat less and exercise more. And in fact, they would have gone through lots of diets. So when they come in to consult you, telling the same thing is going to put them off. They're not going to come to you the next time. So you need to tell them something different, something which is more personalized to them. Don't just give them a name of an app and tell them log into this. Don't do that. Apps do help, but they're complementary. Another thing to remember is your patient should be welcoming. When they come, have proper chairs. There should be no handles. Chairs should be able to bear their weight. There should be proper blood pressure apparatus with large cuff. You should have a tissue box because people may be tearful and they may cry. Make sure you have got a proper weighing scale which can weigh up to 250 or 300 kilograms. So you need to ensure they're invited, they're welcoming, and don't try to blame them. That's what I'm trying to tell you is don't blame them, because it's not their problem. It's our problem as doctors and nurses. It's our problem to get them sorted. And the last advice which I would like to share is always try to encourage your patients. Even if they're lost 5 kilograms or 2 kilograms, it's okay. Just encourage them. And then if they put on some weight, don't discourage them. It's just like diabetes or hypertension. If someone comes with high blood sugar, you're not going to tell them off. You're going to give them an extra tablet. You're going to increase the dose of insulin. That's what you would do, because it's a chronic disease. So obesity is a chronic disease. So please be kind to people with obesity.